Welcome to the Voice of the Coast. I am your host, Danica Long. With me, we have Dr. Eric Brooks. He is the Region 3 Director with Louisiana Department of Health and Hospitals, Office of Public Health. So happy to have you here. It's not like you live around the corner. Well, kind of you do, but I'm happy that you're here with us.
Thank you. Thank you for having me.
And for a lot of you who have been watching Voice of the Coast, typically we have these type of conversations with our coroner, Dr. Eric Melanson, but now we have Dr. Eric Brooks, and we can get all the information we need, particularly about COVID. That's what I definitely want to start off with. But before we actually get to that, let's talk a little bit about you, Dr.
Right.
Brooks. I always ask people, oh, Brooks, where's Brooks? Who's your people? Who's your family? Who's your mama and them?
So I'm originally from Baton Rouge, born. Lived there for a couple of years, but raised mostly a little town called Iota near Eunice. Went to, if you know, familiar with LSU Eunice. Went there for first couple of years, transferred over to LSU in Baton Rouge to finish out my undergrad. Then straight on to LSU in New Orleans for medical school. And then continuing with that tradition, went to an LSU residency back in Baton Rouge for emergency medicine. And that's kind of where I finished out residency in school. So big in Louisiana.
Yep. So definitely from Louisiana, but then to get a little bit closer, you actually have one of our, I like to call her, beloved sweetheart of the area. So tell us a little bit about your wife.
So yeah, my wife is actually locally from the area. She's from Berwick. She was born and raised here. Her mother's here, her grandmother's here, and so like any good Southern woman, just kind of drug me in. And so here I am. I'm happy to be here.
Now, are we able to mention her name?
Yeah, sure.
Okay.
Sydney Birchfield, for those of y'all familiar with the Birchfields. And
Oh, they do.
Carolyn Payrow is her grandmother, because I know y'all be curious to know the whole clan.
See, you're learning. That's, you know, who your mom and them, who your people. You got to drop those last names.
And then a lot of people know her dad too, Lloyd Birchfield, who's a
right.
softball coach and driving around an old blue truck. Old Blue, they know it by.
That's right. So there you have it. That is the link to this area. As always, I mean, look, I told you I'm a transplant myself.
Yep.
So the first thing people ask me, who your people?
Yeah.
Who your mom and them. So definitely have to keep that tradition going and ask you as well. So now that we know there's the link, tell us a little bit about, first and foremost, Region 3. First, this is a big deal. For those who have been following the show, we know that we've had Dr. Melanson, we've talked about Chip Riggins, who's been in that position for quite a number of years. And then to learn that actually there was an interim director by the name of Paul Landry. And now we have you, Dr. Brooks. And that's about 5 to 7 parishes under Region 3. What are those parishes?
That's to be St. Mary, of course, where we're at right now, Assumption, St. James, St. John, St. Charles, Lafourche, and Terrebonne.
Right, and home base for you is in Thibodaux.
Is in Thibodaux. That's where the regional office is right now. So,
okay.
But I do a lot of traveling, getting out to all the parishes.
Yes. So again, thank you for coming out to St. Mary Parish and giving us
Absolutely.
the information. So let's get right into it. I mean, COVID. I mean, is it safe to say it's here to stay?
Absolutely. It's not going to be one of those diseases we eradicate. It's not going to go anywhere. It's something we're going to have to learn to live with.
Yeah. I mean, and right now, the variant we're kind of stuck on right now is the Omicron, right? Do we foresee that maybe, changing?
Absolutely. I mean, right now, I think they're still considering an Omicron, but we're like in a sub-variant. I think BA2 is what they're calling it now. But it's still kind of under the purview of Omicron.
Are we seeing less, deaths associated with this variant?
Our last spike with Omicron, yes, we saw fewer deaths associated with it. The disease severity was overall lower, especially compared to Delta, when we kind of had an uptick in disease severity, unfortunately. So hopefully we continue to see that trend. It's really kind of too early to predict until you kind of get in the middle of it. But hopefully vaccines, if they don't prevent infection altogether, they've been shown to prevent deaths and disease severity. And we've got antiviral drugs now too, like Paxlovid, which has been shown to prevent a significant amount of hospitalizations, up to I think 80–90%.
Okay.
So right now we're not recommending it for low risk populations, but for moderate to high risk, we are recommending it to try to prevent that severe disease.
Yes. Well, we definitely have much more to cover. 2 words, monkeypox. We'll talk a little bit about that a little bit later in the show, but come on back right here on The Voice of the Coast with yours truly and our guest, Dr. Eric Brooks. Welcome back to the Voice of the Coast. I am your host, Danica. Along with me, we have Dr. Eric Brooks, who is the Regional Director for Region 3 of the Office of Public Health with Louisiana Department of Health and Hospitals. So let's get back on talking about COVID and pretty much where we are. I may be saying this wrong, but I'm thinking Omicron is kind of like the watered down version than Delta that we've dealt with before. And we're seeing more people are kind of being able to quarantine and pretty much get over it. They're not being hospitalized as much. Mm-hmm. However, it's still a serious situation that we're dealing with.
Still a serious situation. Like I said, there are at-risk groups. One of the biggest risks as far as hospitalization, death, things like that is going to be age, so your elderly population. And saying vaccines can, even if they don't prevent infection, can prevent severe disease. Along with some of the newer antiviral therapies like Paxlovid. But the thing to remember is you need to talk to your doctor whether you're a candidate for that sooner rather than later. It needs to be taken within the first 3 to 5 days to really have the most effect. After that, when the disease gets to that point where we're either determining whether it's going to require hospitalization or not, it might be too late for that drug to have an effect to prevent that severe disease. So.
And we know that right now it's masks off, but do you foresee masks being mandated, in the future, like kind of going through periods of highs and lows?
Highs and lows. It's a possibility, and I think a lot of that's going to kind of depend on the disease severity, not so much the incidence of it in the population, how many people have it, but how many people are getting really sick from it. If it's causing severe disease, high numbers of hospitalizations, hospital saturations, high numbers of deaths, then we're going to need to try to get a much stronger handle on it again. And that's when I think the mandates really start to come in.
And speaking of which, we've got the summer coming up. Do we see that kind of being an uptick?
Well, I think so, and I think people are kind of antsy to get back out after being kind of basically tied down for the last couple of years. So I think it's inevitable. We'll see another uptick. We're already kind of starting to see that in New Orleans, and it's usually kind of the canary for us. So I think that'll kind of tend to spread out to the rest of the state. But it's yet to be seen how severe this will be. Like I said, hopefully we continue to see that downtrend in severity, and we can kind of start to get back to life as we know it.
Yeah, because like you said, it's going to be a part of life. It is a way of life now. It's just here and pretty much here to stay. You mentioned, we talked prior to the actual interview about mandates, the vaccine mandate, that is. Mm-hmm. New Orleans, being the closest city to us, at one time did for, just to eat at a restaurant. Mm-hmm. Do you think that will, they've kind of relaxed it a little bit, but do you, again, with the uptick coming, do you think that that's something that's also going to be a way of life for the entire state, or you think they were just kind of throwing something out there and trying something?
Well, I think it was warranted when they were doing it, and again, depending on what we see it develop into, this is still an actively changing situation. Things can change week to week, month to month. If we get another, severe wave like we saw in Delta with increased number of hospitalizations and deaths, then I certainly see that coming back.
Yeah. And then you have boosters. It's like so many of them. How many are there that I don't know, particularly the elderly population, the aging population, that's what, recommended for them. But is this going to be like kind of the recommendation you give your children going back to school now? Everyone has to get like additional boosters?
So recommendations are now for to be fully vaccinated is to have your primary series plus 1 booster with the option of a second booster depending on your risk, age, and the immunocompromised. But really the easiest way to think of it is primary series plus 1 booster would be considered fully vaccinated for the majority of the people.
Okay, awesome. Well, again, that's round two. We've got round 3 and 4 coming up next. So, again, as promised, we definitely will talk about monkeypox. This is going to be pretty interesting. Come on back right here on the Voice of the Coast. And as always, make sure to subscribe to us on Facebook. We are KWBJ TV 22. Welcome back to the Voice of the Coast. Again, I am your host, Danica, along with me, Dr. Eric Brooks. Let's get right into it. Before we get to what I talked about before, again, let's talk about quarantine, because the quarantine process was, at first, I think it was like, 14, 12 days, went down to about maybe 10, maybe 7, 5. What's the recommendation now?
So it'll probably change next week as soon as I say something. But
Right.
I believe that the recommendations are right now for 5 days plus at least 24 hours without a fever, without fever-reducing medication. So with resolution of symptoms, up to 10 days. And after 10 days, as long as symptoms are improving, you should be good to go.
Okay. And just for the timestamp, we'll put that out there. This is June 1st. Of course, we do air this over and over again for the information. So June 1st, just know that by June 7th, this could change, or even June 2nd. But let's get on to the monkeypox.
Yep.
You know, I had chickenpox. Like I said, I think I still have something in my face that's still kind of a remnant of chickenpox. My mom made me get chickenpox. My sister had it. She's like, you better do it now before you get older. And thank God I did, because it could be shingles later down the line. But just for, definition's sake, chickenpox has nothing to do with monkeypox. Monkeypox is more similar to smallpox,
The smallpox.
Right? Okay.
Yeah, it's very similar to smallpox.
Okay.
And so a lot of the therapies, including vaccines for smallpox, are effective against monkeypox. And so a lot of those things that we keep in our strategic national stockpile for treatment of monkeypox, or for smallpox, like the vaccines and some antiviral drugs, are effective against it. So,
Okay.
and smallpox has been eradicated. Monkeypox is not one of those diseases that we can really eradicate, because it's what's known as a zoonotic disease. So it lives in nature, mainly in rodents in Africa. It's when it jumped from rodents to monkeys that it was identified back, I think it was in the 50s, and that's kind of where it got the name monkeypox, but its main host is small rodents.
So really, I guess, who wants to have rat pox? I guess if you have to give it a name, monkey maybe cuter. Monkeypox. Okay.
Monkeypox.
So of course, this kind of like made headlines, I guess, months ago, when we heard that possibly one traveler went to Africa, brought it back. But talking to you, monkeypox is not new. Like you mentioned, 1950s, but it's not. I thought it was new to the States, but it's been here before.
I think 2003, and I wasn't. I graduated high school in 2003, so forgive me. I don't really not familiar
Right.
with a lot of details of public medicine at that point, but I think we had an outbreak in 2003.
Okay.
So it's not new, and it's different. It's not the same animal as like COVID.
Right.
If you had monkeypox, or I had monkeypox right now, sitting where we're at right now, even for this period of time, it's extremely unlikely that I would give it to you or you would give it to me. It's much harder to transmit.
Okay, so it's not airborne?
It is, but large respiratory droplets.
Oh,
Large
okay.
respiratory droplets. To reliably transmit within 6 feet, you need to spend 2-3 hours next to each other.
Gotcha. Okay.
Next to each other. And it's mostly close, intimate contact. Direct contact with sores, with linens, things like that. But it's
Gotcha.
much harder to transmit.
Okay. And what's the mortality rate for that?
Well, it's difficult to say, because we haven't had any large outbreaks in developed countries. And so what we know, best estimate, is upwards of 10%. But that's mostly coming from countries and areas with underdeveloped access to up-to-date medical systems, hospitals, things like that, potentially limited access to treatments.
Okay. Can you describe, I've kind of seen maybe a picture of it. Can you describe what they look like?
So they look like blisters, like thick blisters everywhere, or bullae. Sometimes they will develop what we call an umbilicated appearance, where it just looks like they have like a little belly button in the middle, kind of indented in the middle. The rash is typically preceded by think of symptoms that you would have when you have the flu. So fever, chills, aches, things like that, fatigue. From exposure to development of symptoms is anywhere between usually a week to 2 weeks.
Okay, awesome. Okay. Well, thank you again. We've got round 4 coming up. Come on back right here on the Voice of the Coast. Awesome. Welcome back to the Voice of the Coast. Again, I'm your host, Danica Long, and we have Dr. Eric Brooks, who's the Region 3 Director with Louisiana Department of Health and Hospitals, Office of Public Health. We've talked about COVID, talked a little bit about monkeypox, but there's something that you're also responsible for that did not know, and that's hurricane preparedness. You work hand in hand with the Office of Homeland Security and Emergency Preparedness. Like, tell me about that.
So we're mainly responsible for medical special needs shelters. I mean, and the biggest thing to remember with that is we can give you a place to stay, nursing care, things like that, but you need to make sure that if you are evacuating, especially to a medical special needs shelter, that you have all your medications and things like that you would normally need on a day-to-day basis. But yeah, we work very closely with OSEP, the Office of Homeland Security Emergency Preparedness in the region, to coordinate those efforts.
And this is a great day to do it because it's June 1st. This
Beginning
is
of hurricane
the
season.
first day of hurricane season. Oh my
Yeah.
goodness. And it is hot.
It is hot.
And I'm very scared.
Well, there's a development in the Gulf right now too, but it's, hopefully that's going to go to the southern tip of Florida.
Right.
Yes.
This is wild so far. But so that means you're pretty much in full steam ahead. Like it's you're moving with any plans and preparations, plans that you guys have, right?
Yes, ma'am.
And you work with, so our OSEP director is David Nakan, and but you actually kind of schooled me on something, and I was unfamiliar with the fact that although you're Region 3 for for everything else, and we're on St. Mary falls under Region 3. However, when it comes to emergency preparedness, we're not under Region 3. We're technically Region 4, but that doesn't stop you guys from still kind of working together.
Absolutely not. I mean, we're all kind of in the same boat, and for Hurricane Ida. Extremely helpful when they had to evacuate hospitals, Terrebonne General and Chabert, as far as St. Mary taking those patients, taking some of the people. We worked very, very closely together. We met with David Nakan several times so far. And, we're all one big family down here.
Yeah, and obviously, like I said, this is the first day. So you're still new at this, right? I mean, you've been in this position since March. And
March 1st.
Just got out of May and it's June, so you're still kind of getting your feet wet, right? Will there be anything new that you'll be adding? Because this thing's pretty much constantly evolve, right? So
yeah.
Anything you're hoping to maybe add to your office?
Right now, I mean, the biggest challenge is still getting to know all the players' names and faces. I mean, it's there's something new to learn every day, but it absolutely is when as I get more comfortable in the position, we certainly hope to do a lot of outreach and have a significant presence in the parish. And everybody I've met with, as far as parish presidents and public, we have an open door policy. If you need me, don't hesitate to call, and I'm happy to answer any questions, do any kind of outreach.
Well, I know how to get in contact with
you.
you. Yes.
You do.
So I won't bother you. I tell this to everybody. I won't bother you. I just will call you when we really, really, really need you. We need some updates.
You can call anytime. You got my number.
I appreciate it. And we just have a few more minutes left. I just want to kind of talk to you again. You're new to this. What's your day-to-day operations? Because we technically are still kind of operating under the fact that we're in a pandemic. So it's not a lot of like face-to-face. I mean, thank you for coming in. We appreciate it, though. But
yeah, my day usually starts off and is usually filled with a myriad of Zoom meetings. Being new to the position, I would like nothing more than to go and meet people face to face. And I mean, Zoom is amazing, but it's almost a blessing and a curse. But unfortunately, we do have that available. But it's nice to get here and get out and talk to people and meet people, because it's
being cooped up in an office, all day. Look, I've had some Zoom meetings, and we've done at least a few here. I do prefer face-to-face, and we try to keep ourselves distant so that we are still kind of, adhering to any COVID protocols and, you know, requirements that are out there. So to keep everybody safe. But you're from South Louisiana. You know, we love the hospitality. We love to talk to people and talk face to face. So again, we thank you very much for being here and, you know, pretty much educating us on what it is that you do, but also giving us, you know, some of your time. So thank you again.
Absolutely.
And we'll see you sometime later in the future, right?
Yeah, absolutely,
Okay,
anytime. You got my phone number.
Awesome. Okay, thank you and thank you guys. Make sure to subscribe to us on Facebook. We are KWBJ TV 22. And also check us out on YouTube. We're KWBJ Live. Guys, take care and please be safe.